Okay, we got scanning and room. My patient. Okay. Okay. There you go. Come in. Hey, hi, my name's Madison. I'm your student nurse. I'm going to shut the door for privacy. I'll wash my hands over here. Are you in any pain today? Nope. Do you have any allergies? Nope. Okay, can I see your wristband? Can you tell me your name and your birthday?
Kelly Henderson, July 8th, 1996.
Okay, and do you know where we are?
Yes, we're at University.
And why are we here?
For school.
And do you know what year it is?
2016.
Okay, patient is learn-oriented, ×4. She is well-groomed, looks of good hygiene, no body odor or breath odor. She looks her stated age. Her speech is fluent and no slurring or anything. Her mood is appropriate for the situation. And is it okay if I assess you tonight? Yep. Okay, can I touch your head? Okay. Hair is thick and soft and well distributed. No lesions or masses noted. I'm gonna test for facial symmetry. Can you close your eyes and tell me where you're touching on your face?
Forehead, nose, cheek, chin.
Okay, and then can you smile for me and puff your cheeks? Okay, and her face is symmetrical, so cranial nerves 5 and 7 are intact. And I'll look at her pupils now. They're round, about 4 millimeters, equal. And just straight ahead. They're both reactive to light, and accommodation is present. Can you pull down your conjunctiva is pink? And we're going to look at her mouth now. You can open your mouth. Oral mucosa is pink and moist. All teeth are present. Her gums are pink and strong. Can you sit out your tongue for me? Tongue has no coating or any signs of lesions. Tonsils are 2+ bilaterally. Her uvula is midline, and her tongue is midline as well. I'm going to feel for your carotid artery, one at a time. And they're equal 2+ bilaterally, and I'm going to auscultate with the bell side of the stethoscope. And can you hold your breath for me? Okay, you can breathe. And hold your breath. Okay. No signs of bruise. Okay, I'm going to go down to your arm. Can you stick your arms up for me? Okay. Skin is warm to touch. Hair is even distributed. Her skin tone is appropriate for ethnicity. Can you squeeze my fingers for me, please? Strength is normal and equal on both sides. Capillary refill is under 3 seconds. No signs of clubbing. There's no lesions or moles on her arms that would be of concern. And then I'm going to listen to her heart now. I'm going to start the diaphragm at the aortic, which is second intercostal space, right sternal border. And then we're going to move over to pulmonic, which is second intercostal space, left sternal border. Down to herbs, which is third intercostal space, left sternal border. And then tricuspid, which is fourth intercostal space, left sternal border. And then over to mitral, which is fifth intercostal space, mid-clavicular line. And this is where I would listen for 60 seconds. And then we'd switch it over to the bell side of the stethoscope. And we go back up for mitral, tricuspid, herbs, pulmonic, and aortic. Heart sounds are strong and clear. And then so now I'm going to listen for her lung sounds and go back over to the diaphragm. And then can you just take a deep breath every time I move the stethoscope for me? Okay, we listened in 10 spots. No adventitious long sounds on the front. Can you turn around for me, please? You can listen to the back. We're going to listen to 10 spots on the back as well. Just take a deep breath every time I move the stethoscope. Her lungs are clear. No adventitious sounds. Can you bend over for me for a little bit? Feel for her spine. It is straight, no signs of any curvages or anything. You can sit back up. I'm going to test for her costovertebral angle. Can you just tell me, once I hit it, if there's any tenderness or pain? Oh. Okay. Then you can turn back around. You can actually lay down for me. Okay. And you lift your stomach up. Okay. The contour is flat. There's no signs of distension or anything. Her umbilicus is midline, but a navel piercing is noted. To inspect, also take, palpate, then percuss. I'm going to start in the right lower quadrant. This is where her right ovary, right ureter, and ascending colon is. And then the right upper is the liver, gallbladder, and her right kidney. And then we're going over to her left upper quadrant, which has her left kidney, her spleen, and her stomach. And then the lower left quadrant has her left ureter, left ovary, and the pancreas. Her bowel signs are present. Okay, now I'm going to palpate. Can you just tell me if there's any tenderness or any pain? No. Okay, and now we're going to percuss. There's tympany in all 4 quadrants. You can go ahead and sit up for me. There's no jugular vein distension. And so now we're going to move down to her lower extremities. Her skin is warm to touch, again appropriate for ethnicity, no moles or lesions noted. Hair distribution is even. We're going to feel for her popliteal pulse, which is unable to evaluate to. It's not. I can't feel for it. It's not there, or it is there, but I can't feel it. And then we're going to her tibial, which is 2 plus equal bilaterally, and then the dorsalis pedis, which is 2 plus equal bilaterally, and then we're going to go back up and feel for your brachial pulse. I forgot to do that. That's 2 plus equal bilaterally, and her radial is 2 plus equal bilaterally. There's no edema present in her ankles or her feet. Capillary refill is under 3 seconds. Then can you lay back down for me so we can do the Babinski test? So I'll do that when she's laying down. Thank you. And I'm going to use the bottom of my pen light to do this. Now from the bottom up to the big toe. And it is negative, so that is good. And then I'm going to have you stand up for me, please. And we're going to do the Romberg test. And I'm going to stand with your arms to your side, your feet together, and close your eyes. We're going to do 20 seconds. 20 seconds up. Everybody else is good. Get up and go test. I'm going to walk for me, please. Gait is steady and natural. No signs of limping or anything. And that's it. Good.